There is a number that sits in the back of a lot of people's minds. Not constantly, not every hour of every day, but it is there. It surfaces when you sit down at a doctor's appointment and the cuff goes around your arm. It surfaces when you feel a headache coming on, and you wonder, for just a moment, whether it is something more than a headache. It surfaces when someone you know has a stroke, a neighbor, a friend, someone your age, and you think about your own number and whether it is where it should be. If you know exactly what I am talking about, this video was made for you. Blood pressure is one of the most consequential numbers in your health. Not because it is complicated, it is actually one of the simplest measurements in medicine, but because of what happens when it stays elevated for months and years without adequate support. The damage it does is quiet, incremental. It builds in the walls of your arteries, in the tissue of your heart, in the delicate blood vessels of your kidneys and your eyes and your brain. By the time most people feel symptoms, the process has already been running for a long time. What I want to talk to you about today is something specific and something practical. There is a window in the evening, the hour or so before you go to sleep, that research increasingly suggests is one of the most important windows in the entire day for blood pressure management. And what you drink during that window can either support your cardiovascular system through the night or do nothing for it at all. Most people use that window on a glass of water if they are being careful, or on something sweet or caffeinated if they are not thinking about it. Very few people know what the research actually points to as the most supportive choice for blood pressure during the overnight hours. And that is what I am going to walk you through today. But before I get there, I need to explain what is actually happening in your body overnight. Because once you understand the mechanism, the recommendation makes complete sense, and you will be far more likely to follow through with it consistently. Here is something that surprises most of my patients when I explain it. Blood pressure is not a fixed number that stays the same throughout the day. It follows a natural rhythm. During the day, in response to activity and stress and movement, it tends to be higher. And in healthy people, it drops during sleep, sometimes by 10 to 20%, in a pattern researchers call nocturnal dipping. That overnight dip is not a passive coincidence. It is an active, protective process. During those hours of lower pressure, your heart gets a period of reduced workload. Your arterial walls have a chance to recover from the stress of the day. Inflammation markers in the cardiovascular system tend to fall. The body uses that quiet window to repair. People who show this healthy nocturnal dip have meaningfully better long-term cardiovascular outcomes than those who do not. Their risk of heart attack and stroke over time is lower. Their kidneys are better protected. Their arteries age more slowly. Now, here is where it becomes relevant to what you drink before bed. In people whose blood pressure does not dip adequately overnight, a pattern called non-dipping, the cardiovascular system never gets that recovery window. The pressure stays elevated through the night. The workload on the heart continues. The inflammatory processes in the arterial walls continue. And the cumulative effect of that, night after night, month after month, is significant. What drives non-dipping? Several things. Stress, poor sleep quality, excess sodium, certain medications, obesity, sleep apnea. But one of the most modifiable factors is the biochemical environment your body enters sleep with. Specifically, the state of your nitric oxide system, your magnesium levels, and the degree of vascular inflammation present when you lie down. And this is exactly where what you drink in the hour before bed becomes meaningful. The drink I am going to walk you through today, the one the research most consistently supports for blood pressure during the overnight window, is hibiscus tea. I want to take a moment before I go further to say something clearly. Hibiscus tea is not a medication. It will not replace antihypertensive drugs for someone who needs them. If you are on blood pressure medication, please do not adjust your medication based on anything in this video without speaking to your doctor. What the research shows is that hibiscus tea, consumed consistently, can provide meaningful nutritional support to the systems that regulate blood pressure. and that this support is real, measurable, and increasingly well documented. It is a tool, a genuinely useful, evidence-backed tool, not a cure. Now, let me tell you what is inside hibiscus tea and why it does what it does. Hibiscus tea is made from the dried calyces of the Hibiscus sabdarifa flower, the deep red, slightly tart petals that give the tea its distinctive color and flavor. That color is not incidental. It is produced by a high concentration of anthocyanins, the same class of antioxidant pigments found in blueberries, pomegranates, and red cabbage. And anthocyanins have a specific and well-studied relationship with cardiovascular health that goes beyond general antioxidant activity. Anthocyanins in hibiscus have been shown to inhibit an enzyme called angiotensin-converting enzyme, ACE. You may have heard of ACE inhibitors. They are one of the most commonly prescribed classes of blood pressure medication in the world. They work by blocking this enzyme, which is part of a hormonal system called the renin-angiotensin system that regulates blood vessel constriction and fluid balance. When ACE is inhibited, blood vessels relax. The resistance that blood faces as it moves through your arteries decreases. Blood pressure falls. Hibiscus contains compounds that work on this same pathway, not with the potency of a pharmaceutical drug, but through consistent daily dietary exposure. And the clinical research supports this effect more strongly than most people realize. A randomized controlled trial published in the Journal of Nutrition followed adults with mild to moderate hypertension who consumed hibiscus tea daily for 6 weeks. The group drinking hibiscus tea showed a meaningful reduction in systolic blood pressure, the upper number, compared to the placebo group. The effect was most pronounced in participants with higher baseline blood pressure. A meta-analysis published in the Journal of Hypertension, which pooled data from multiple randomized controlled trials, found that hibiscus tea consumption was consistently associated with significant reductions in both systolic and diastolic blood pressure. Another study, conducted at Tufts University and published in the Journal of Nutrition, found that 3 cups of hibiscus tea daily reduced systolic blood pressure by an average of 7 points in adults with pre-hypertension. 7 points of systolic blood pressure reduction, achieved through a daily dietary habit, is clinically meaningful. It is the kind of reduction that, sustained over time, translates into real changes in cardiovascular risk. But the ACE-inhibiting effect of the anthocyanins is only one part of the mechanism. There is a second pathway that is particularly relevant to the evening timing recommendation. Hibiscus tea is a meaningful source of dietary nitrates, and nitrates, when consumed, are converted in the body into nitric oxide, a molecule that causes the smooth muscle in blood vessel walls to relax, widening the vessels and reducing resistance to blood flow. Nitric oxide production is one of the primary mechanisms through which the body regulates blood pressure naturally. It is also one of the mechanisms that tends to become less efficient with age. When you consume hibiscus tea in the evening, the nitric oxide produced from its nitrates is available in your system during the exact window when your body is trying to achieve that protective overnight blood pressure dip. You are essentially providing biochemical support for a process your cardiovascular system is already trying to accomplish. You are making it easier for your blood vessels to relax and dilate through the night. The third mechanism involves magnesium. Hibiscus tea contains a modest but meaningful amount of magnesium, and magnesium's role in blood pressure regulation is one of the most well-established relationships in nutritional medicine. Magnesium is required for the proper function of the sodium-potassium pump in blood vessel cells, the mechanism that regulates how much sodium stays inside cells and how much leaves. When magnesium levels are insufficient, cells retain more sodium, blood volume increases, and blood pressure rises. The majority of adults over 60 are magnesium insufficient, and that deficiency is a quiet but consistent contributor to elevated blood pressure that most people have never been told about. A warm cup of hibiscus tea in the evening provides a small but regular contribution to magnesium intake, alongside its other cardiovascular active compounds. I want to tell you about a patient I will call Harold. Harold was 73 when he came to see me. He had been managing high blood pressure for 11 years, and his cardiologist had adjusted his medications twice in the past 3 years because his readings, despite the medication, were stubbornly elevated in the mornings. Not dangerously high, but consistently higher than where he and his doctors wanted them. His morning readings were always the worst. He would check his blood pressure when he woke up, and the number would sit there, frustrating him before the day had even begun. Harold was not a man who embraced change easily. When I suggested hibiscus tea, he looked at me with the particular expression of a man who had not expected a serious medical conversation to end with a recommendation about flowers. I told him to give it 8 weeks. 1 cup of properly prepared hibiscus tea 30 to 60 minutes before bed, every night, alongside everything else he was doing. Just that one addition. At 8 weeks, his morning readings had dropped by an average of 6 points systolic. Not transformative on its own, but combined with his medication, his diet changes, and his daily walks, it moved him from a range that concerned his cardiologist to one that no longer did. His cardiologist asked what had changed. Harold told him about the tea. The cardiologist's response was straightforward. Whatever you are doing, keep doing it. Harold still drinks his hibiscus tea every evening. He told me recently that it has become the most consistent part of his day, a ritual he genuinely looks forward to. Something that feels like doing something good for himself rather than avoiding something bad. Now, let me be precise about how to prepare hibiscus tea correctly, because this detail matters more than most people appreciate. The first thing to understand is that hibiscus tea is not all equal. The potency of the anthocyanins and other active compounds varies significantly depending on the quality of the dried hibiscus used, how long you steep it, and the temperature of the water. Most commercial hibiscus tea bags contain adequate amounts if prepared correctly, but loose dried hibiscus flowers, which you can find at most health food stores and many grocery stores, generally provide a more concentrated preparation. Use 2 to 3 grams of dried hibiscus, approximately 1 heaped teaspoon of loose flowers, or 2 tea bags per cup of water. Bring your water to just below boiling, approximately 90 degrees Celsius, or just before the full rolling boil. Pour it over the hibiscus, cover the cup to trap the volatile aromatic compounds, and steep for 5 to 10 minutes. The longer the steep, the more anthocyanins and active compounds are extracted. 10 minutes produces a significantly more concentrated cup than 2 minutes. The color should be a deep, rich burgundy red. If it looks pale or pinkish, you have either understeeped it or used insufficient hibiscus. Color is a reasonable proxy for anthocyanin concentration. Do not add milk or cream. The proteins in dairy can bind to anthocyanins and reduce their absorption, the same mechanism we see with tea and coffee when milk is added. A small amount of raw honey is fine and will not meaningfully interfere with the active compounds. A slice of fresh lemon or a few drops of lemon juice will actually enhance the stability of the anthocyanins and add a small amount of vitamin C, which supports blood vessel health independently. Drink it approximately 30 to 60 minutes before bed, not immediately before lying down. You want the active compounds to be circulating in your system as you fall asleep, not still sitting in your stomach. That 30 to 60 minute window is the timing that research supports for maximizing the overnight blood pressure effect. Temperature matters too. Warm is better than cold for this purpose. Warm liquids support the relaxation response that the body naturally initiates in the lead up to sleep, and they are absorbed more quickly than cold ones. Now I want to address some practical questions that come up regularly when I discuss hibiscus tea with patients. The first is tartness. Hibiscus tea is notably tart. It has a natural acidity from the organic acids in the flower, particularly hibiscus acid. Some people love this immediately. Others find it takes a few days to adjust. If the tartness is challenging initially, reduce the steeping time slightly and add a small amount of honey. Do not add sugar liberally. Excessive sugar in the evening is counterproductive for blood pressure and for sleep quality. The tartness genuinely does become pleasant over time for most people. It is a flavor that grows on you, and many people who start drinking it for health reasons find they genuinely miss it when they run out. The second question is about safety and interactions. Hibiscus tea is generally very well tolerated. However, there are two important cautions. First, if you are taking medication for blood pressure, there is a real possibility that hibiscus tea adds to its blood pressure lowering effect. This is not necessarily a problem, but it means your doctor should know you are drinking it, and you should be monitoring your blood pressure to ensure it does not fall too low, particularly if you feel lightheaded or dizzy. Second, hibiscus may interact with certain medications, including some diuretics and the drug chloroquine. If you are on prescription medications, a brief conversation with your doctor or pharmacist before starting is sensible and straightforward. The third question is about alternatives and additions. Is there anything you can add to hibiscus tea to make it more effective for blood pressure? Yes. Two additions in particular have good evidence behind them. The first is a small amount of tart cherry juice, 1 to 2 tablespoons stirred into the hibiscus tea. Tart cherry is rich in melatonin precursors and has been studied for its ability to improve sleep depth and duration. Better sleep quality is independently associated with better nocturnal blood pressure dipping. The combination of hibiscus and tart cherry creates a drink that supports both the vascular and the sleep dimensions of overnight blood pressure management simultaneously. The second addition is a 1/4 teaspoon of unsweetened cacao powder. Cacao is one of the richest dietary sources of flavonols, specifically epicatechin, which has been shown in multiple trials to support nitric oxide production and endothelial function. Whisking a small amount of cacao powder into your hibiscus tea creates a drink with complementary mechanisms working alongside each other. The anthocyanins and ACE inhibiting effect of the hibiscus, plus the flavanol-driven nitric oxide support of the cacao. The combination is slightly unusual but genuinely pleasant. A tart, slightly chocolatey warm drink that does real cardiovascular work. Now, let me step back and place this in its broader context, because I do not want this video to leave you with the impression that a single evening drink is sufficient for blood pressure management. It is not. And anyone who tells you otherwise is not giving you the full picture. Blood pressure is regulated by multiple systems: your kidneys, your hormones, your nervous system, the structural health of your arterial walls, your body weight, your sodium intake, your physical activity level, your sleep quality, your stress levels. No single food or drink addresses all of those systems. What a consistent daily habit like evening hibiscus tea does is contribute meaningfully to one part of the picture, the vascular and nitric oxide dimension, in a way that compounds over time. The people who see the most significant benefit from hibiscus tea are the people who drink it consistently, as part of a broader approach that also includes reducing sodium, increasing potassium through fruits and vegetables, maintaining some form of daily physical activity, managing stress, prioritizing sleep, and working with their doctor on medication management where it is needed. Think of hibiscus tea not as a solution, but as a daily deposit into your cardiovascular health. Small, consistent, directional. Each cup doing its quiet work while you sleep. The benefit is not dramatic on any given night. Over weeks and months, it accumulates into something measurable. Before I close, I want to come back to something I said at the very beginning. The number that sits in the back of people's minds. Blood pressure is not a verdict. It is a measurement of a system that is responsive to what you do with it. The research on this is genuinely encouraging. The endothelium, the lining of your blood vessels, responds to nitric oxide. It responds to antioxidants. It responds to reduced sodium and increased potassium. It responds to exercise and to sleep. It is not inert. It is not simply aging in a direction you cannot influence. You have more control over your blood pressure trajectory than most people have been led to believe. Not unlimited control. Not the ability to override genetics or serious disease with a cup of tea, but real, meaningful, measurable influence through consistent daily choices. Hibiscus tea in the evening is one of the simplest and most evidence-backed of those choices. A cup of deep red tea, 30 minutes before bed, prepared with care, drunk as a deliberate act of looking after your cardiovascular system. That is a ritual worth starting tonight. If this was helpful to you, please subscribe to the channel. Every week, I bring you evidence-informed health information designed specifically for adults over 60, in plain language, without hype, focused entirely on what the research actually shows. Leave a comment below and tell me, are you currently managing blood pressure? Have you tried hibiscus tea before? I read every comment, and your experience genuinely helps shape what I cover next. Share this with someone in your life who checks their blood pressure number and wonders what more they can be doing. This might be exactly what they needed to hear. I am Dr. Julian Cross. Take good care of yourselves tonight, and I will see you in the next one.